All right, hello. Thank you, Lizzie. Hey, everybody. My name is Adam Kadmon. I'm an LCSW, which basically means, social workers in the house. I'm a clinical social worker, also a clinical supervisor. I specialize in doing KAP work and preparation and integration with clients. I primarily specialize in working with complex and developmental trauma. So that's really the heart of my practice. It's the heart of what I do with psychedelic work. I also specialize in doing experiential therapy, so doing a lot of body-based therapies and really focusing on kind of the existential and spiritual aspects of trauma healing, which in my experience in my work, I think ketamine and other plant medicine psychedelic compounds are just some of those radically transformative tools that you can access and experience. I'm also a Virgo. I'm practicing Zen Buddhist. I think that's it.
Hi guys, I'm Susan. I am an LPCS, which is a licensed professional counselor supervisor, and I'm also a clinical supervisor as well. And I have been with Journey Clinical now for about 1.5 years, and I primarily work with a lot of clients who have significant trauma history as well. And so I'm really happy to be here and talk all things ketamine and the benefits of ketamine-assisted psychotherapy. So thank you.
Hey everybody, thank you so much for spending your Friday evening with us. My name is Brittany. As Lizzie said, I'm one of the prescribers. I'm a dual certified nurse practitioner, so started my career in family practice where, as we all know, we see a lot of mental health. That's where I first learned about ketamine and first started prescribing it. I absolutely loved the benefits and the effects that I was seeing in my primary care clients, so I went back to school and became a psychiatric mental health nurse practitioner, and now I do ketamine full time. So I've been working with ketamine in pretty much every route, nasal spray, IV, IM, now RDTs, since 2019, and I've been with Journey specifically for almost 2 years now. So I really enjoy this work. I really enjoy supporting the gold standard of doing ketamine with therapy. And I'm really excited to have this conversation with all of you guys tonight.
So I'm going to pass it actually back to you, Brittany, to give some more context. I know we have some people here who are really experienced in KAP, and we have a lot of new people who are here to learn. So I wonder if you could share a little bit more about the science of KAP and the effect of ketamine on the brain, and then we're going to talk to the therapists about how they utilize that in their practice with the therapy.
All right, awesome. So, ketamine is unique. It does work a little different than your traditional antidepressants. Of course, we all heard of the SSRIs or SNRIs, which primarily work on neurotransmitters like serotonin. Ketamine works on a glutamate system, so it works with the glutamate neurotransmitter, which is excitatory, but it's also what helps us with learning, memory, and neuroplasticity, which is that magic word that we all hear about when we think about psychedelics. So with neuroplasticity, I really like to use this analogy. Kind of think of your brain like a ski slope. With repetitive thought patterns over the years, it carves really deep grooves in your brain, and it's really hard to change direction or change the patterns. When you introduce something like ketamine, you're eliciting that neuroplastic effect, and it's kind of like laying fresh snow over the brain, so it's covering up those grooves, and it's almost like creating a nice clean slate. And that is what gives clients the opportunity to then make new pathways, change direction, and change their thought patterns, which what our lovely therapists will actively help clients do. So it's important to know that ketamine alone, yes, it increases neuroplasticity, but that's often short-lived. So that's why ketamine-assisted psychotherapy is gold standard, because with the psychotherapy part, that's where clients are able to take the insights that they're getting from the experience and actually apply them, make sense of it, and make those long-lasting, meaningful changes.
So we've mentioned a couple times the sequence: preparation, dosing, integration. So as you share a little bit about the work you do, I would love to hear from you two therapists about what that looks like, how you support clients through that process. We're going to get into a lot more detail also, but feel free to share whatever. I know that people love to hear and
get the nitty-gritty details, so go for it.
So typically I'll meet with my clients maybe 2 to 3 sessions in advance before we start any dosing sessions, and in that time I will get a lot of background information, I'll get a lot of history, learn about some of their relationships and see what their goals are. And a lot of the times they come in really open-minded and they aren't really sure exactly what specifically they want to have as a target goal or a specific intention before their dosing sessions, and so that's where I come into play. And so based on what it is they share, we can kind of delve a little bit deeper and then determine what we think could be like a good mantra or a good message or maybe a meaningful song that they want to listen to while they're dosing. And so we try to make it, a very focalized, specific goal in mind. And then they'll have their dosing sessions, and then after their dosing sessions is when we are now going to work on integration. And so with integration, I kind of call that as like the time to strike while the iron is hot. And so we'll now start putting into practice some of the different goals that they have in mind. For example, I have a client who has really struggled with really severe loneliness throughout their whole life. They don't really have any significant relationships, there's no family history, and so they have just felt, super alone. And so in his integration phase, we talked about ways that he could try to start creating and cultivating some of these relationships. And so I really encouraged him to, do things that he would typically have shied away from. And so shortly after his dosing sessions in that week, he signed up for dance classes and he went to meetup groups, and I think it was comic books and coffee in the mornings, and it was just really cool to see him now have the courage and the motivation to do something different so that we could try to really, implement these practices and hope that it could feel more natural for him while the neuroplasticity, was in full effect. And so it has been really cool meeting with him and hearing the positive results and already starting to create some new relationships and friendships in his comic books and coffee sessions. So yeah, it's amazing. It's really cool work.
Yeah, I would say I do a lot of very, very similar work with my clients. Because of the specific kinds of therapies that I do, which are really focused on, in a way, not necessarily having insight into why is it that I feel a certain way, why is it that I might struggle with depression or anxiety. The approach I take with clients is that we're trying to utilize, let's say ketamine in this case, to create a radically different experience of the self and how someone relates to themselves and other people, like myself in the room or the world around them. So a lot of how I would say what inspires my work with clients is an old phrase, I believe it was from Ian Schulke, that said, the idea of going through these non-ordinary states and then doing integration is that we want the inner state or the inner kind of experience during, let's say, having a ketamine experience to eventually become a generalized state that person lives from. So a lot of the work I do with clients in preparation, in the dosing session itself, and then in integration is trying to understand how a lot of what clients come in and struggle with without any conscious awareness is usually deeply protective in nature. So someone is coming in and they might be struggling with depression, and our goal, I would say, if there is a specific goal, is to understand how that depression or anxiety is actually deeply protective for that client, usually with origins in historical trauma, childhood trauma, development, even birth trauma, peri and prenatal trauma that this client may not have any conscious awareness of, but in the ketamine experience, that unconscious memory, somatic body-based memory, emotional learning, these things become radically open to experience. And ideally, if we do good work, I would say kind of throughout all phases of the ketamine experience, we get a chance to, using the kind of snow that's then laid over the brain, to understand that why were those tracks there? What was it that was keeping those tracks there in the first place? And when we develop a deeply conscious awareness of what those tracks were doing for us, it then opens up the alternative to find a different way to find the same destination using a different track down the mountain, let's say.
Thank you all so much. I'm going to back up a little. This is fascinating to hear about the work that you're doing now, and I want to hear, how did you get into this? What brought you to this work? How did you find yourself here on this panel tonight?
All right, awesome. So, very different start to my career, actually. I became a nurse in 2014, and I went right into open heart surgery, and I did that for about 6 years, and I thought I was going to do that forever. I love surgery. I love being in the action. So that is actually why I primarily went to NP school. I thought I was going to assist a surgeon, and that ended up not working out. And I think honestly, it's just the universe putting me on the right track. I landed in family practice, where I really learned that I loved working with clients that were dealing with mental health. And like I mentioned earlier, that's where I learned about ketamine. It's really funny. This pharmacist came in through the doors of our family practice and was just raving about ketamine, and we were just like, who is this crazy guy that's just like swinging around these tablets? But it was intriguing, like his approach worked, and I called him up. I actually went to his pharmacy and I had him teach me all about it. And I tried it out on an ex-NFL player, which was one of my patients. He had really bad concussion syndrome, which caused a lot of depression, and he was on a lot of benzos and just miserable. And so we talked, and I was like, hey, I just learned about this new thing. It's called ketamine. Do you want to give it a try? And he had phenomenal results. He was able to wean off some of his benzos, which is really zonking him out. And that's when I was like, what is this stuff? Like, oh my gosh. So I learned that there were clinics out there that just did ketamine. And so I was like, heck yeah, let's dive fully into this. And so that's basically what kickstarted my career. And it actually started very medical model, because when I started doing ketamine, KAP wasn't like super, super huge. And knowing what I know now, I'll never go back to medical model KAP. Like seriously, where the long-lasting benefit is with KAP. And also doing it ceremonially and bringing in the spirit and bringing in ancestral work, all of that together, the somatic, IFS, EMDR, all of those beautiful things together make a great recipe for healing for clients. So yeah, that's where I started, and that's why I'm here.
So I started because I was actually on the receiving end at an all-day retreat with Brittany being my prescriber. And it was such a transformative, beautiful, positive experience for me that I was just so eager to then be able to share this with my clients and the community as well. And so, yeah, it's full circle now.
I would imagine probably like many people who get into this space, I am also a member of having my own transformative experiences. For me, I think this route started 30 years ago in starting to study spiritual traditions and practicing meditation, practicing yoga, and at some point you're doing that stuff and after you're going to come across some kind of experience or just some kind of wisdom or knowledge or practitioners who are engaging with psychedelics and plant medicine. So for me, I had an experience in a number of them in my early 20s that just, to me, to this day, I still say it just saved my life, just straight up. And I think from that moment onward, I think I was such a believer in the power to radically transform someone's life, especially when maybe trauma is really prevalent in their background. And I think I became a pretty hardcore zealot for this work because of that. And then also I just find that the kind of spiritual, philosophical aspects of doing any kind of psychedelic experience also are just equally valuable. And a lot of the clients I work with, and for myself too, there's healing elements that I think are what draw me to doing this work, but then there's also just the kind of love of adventure and exploration and kind of exploring the possibilities of consciousness, which a lot of my clients, kind of the idea is healing is the first part of the journey, but ideally we're healing to then engage in a philosophical, spiritual quest of being a human being with a body. And to me, that's kind of what brought me here, and I think it's what keeps me here, is knowing that this is a just really unique way to do that work.
Thank you all for sharing your stories. And now we're here to celebrate tonight. There's big momentum for the KAP movement here in Austin, across Texas. I forgot to mention, Texas is actually our third largest state of KAP providers, just behind California and New York. It's our fastest growing, so it's very exciting to be here and celebrating with you all. And since we're in the celebratory mood, I want to celebrate some wins, some client wins. So if you have any stories that you'd be willing to share about clients and how KAP treatment has helped them perhaps make a breakthrough, I would definitely love to hear those stories.
So I'll go ahead and go because I had a KAP session 2 hours before I came here. So a client of mine, history of undiagnosed neurodivergence for the first 50 years of his life. Very, very in-depth, very severe trauma history. We had this moment today in KAP where noticing that for the first time in a number of sessions, he was starting to move his body more kind of routinely throughout the session. And whenever we finished, we were kind of starting to engage in some experiential talk therapy and exploring what was happening in his body. And he kind of looked at me with this like shock of revelation, and he said, you know, I realized just now that my entire life I've been like a pilot in my head, piloting my body. And I just now, for the first time, got to experience what it's like to actually be in my body and express myself through my body. And, you know, that was a leap forward in his treatment, and I think his work towards healing from trauma that, I mean, maybe that would have taken who knows how many years with deep therapeutic work, even like really hardcore deep trauma work that may not have happened for who knows how long. So he walked out and he was like, I'm just going to go run around and just explore having a body for the first time. And so yeah, that's a big win this week.
He's out running around right now.
Safe.
So I just had a new client that I met with this past week, and this client is a veteran and was a fighter pilot and recently was discharged. And they started their ketamine infusions, I believe, in September. And this client also said since September, since the first time they started their infusions, they did not experience a single migraine in their whole, and they've experienced migraines their entire life, but not a single migraine since September. There's no more nightmares, and anxiety had been down in general as well. And so I thought that was a really cool story. Another really amazing, beautiful client story too was working with a client who has experienced a significant amount of grief in her life, and so from that also has treatment-resistant depression that she's really struggled with for the duration of her entire life as well. And when she was going through her infusions, at one point when we met, she decided, you know, is this what it's like to not cry for a week? And I just thought that was like such a profound revelation for her, and I was just so excited that she finally was starting to experience some relief herself. So those are some of my favorite and most recent experiences and stories.
Thank you so much. And we heard some outcomes there from your clients. I wonder if Brittany, you can share a little bit more about the model that we work with during clinical with the sublingual lozenges. Can you explain to people, I think, you know, breaking down actually what happens in a dosing session, how the client experiences it. You could even maybe walk them through how you work with the client. So what happens in that intake? How do you prescribe for the ketamine? What do you prescribe? All those kind of details.
Yeah, so what Lizzie said, our model brings KAP into our therapist's private practices, so it really allows the client to do their experiences in a space that they're already comfortable with. So we take care of pretty much all the medical stuff. So to get started, a client has to do a full psychiatric and medical evaluation, which I think sets us apart from a lot of companies where they do like 30-minute, 15-minute, like quick check-ins. We do full evaluations. All of our prescribers are psychiatric mental health prescribers. So we get full history, background, medical, social. I get to learn their story, what their support system is like, all their past experiences. We start with that initial intake. From the initial intake, we prescribe for 2 ketamine sessions. They're going to be rapid dissolving tablets, which is ketamine that you'll put underneath your tongue and hold it, let it dissolve. we start with 2 sessions so that the client can go try out the experience first and also try out and make sure that the dose was right for them, and also to make sure that they're not having any side effects and stuff, because we really want to make sure we're checking in on that. After they complete those first 2 doses, they'll come back in for follow-ups, and then we can prescribe for up to 6 dosing sessions after each follow-up. So as a prescriber, my role is to make sure that we're ensuring safety and make sure that ketamine is being delivered responsibly. So we keep track of the usage. We do it low dose and controlled. And then we also collaborate really closely with our therapists. So we create individualized treatment plans. Every time I see a client, I'll curate a treatment plan, and it gets sent right to their therapist. So every time, you know when I see one of your clients, because you'll get a message with everything, their blood pressure parameters and how much ketamine they're prescribed. And then on our portal, the way we collaborate is we're always in touch virtually with each other and also with the client. So we can message 3-way and always be in the loop. And then also we work very closely with our therapist. At any time, we do one-on-one virtual meetings or even full caseload reviews. So yeah, we're always connected. Did I answer all the questions? Okay. Yeah.
Thank you. And something that I think sometimes is an aha moment for people who are new to this work is that the client during a dosing session is reclined with an eye mask and headphones. So they're having a very inward experience typically. It's typically about 45 minutes round trip, I like to say. And then they'll be coming back into their body. Some clients, might share right away with their therapist. And some might be more quiet, and then they, of course, always come back for that integration session in that window of neuroplasticity. So that's a little bit about that piece as well. Yeah. And I would love to hear, so maybe that was an aha moment for you. Maybe you have only heard of IV ketamine clinics or different modalities out there. There's a lot of great information about KAP if you go looking for it, and we're trying to create more momentum around it. And there's also sometimes misconceptions about this work and what it is, the safety profile of ketamine. A lot of people aren't familiar with the fact that, ketamine's in every hospital around the world. It's on the World Health Organization's list of essential medicines. It's been FDA approved as a dissociative anesthetic for anesthesia since 1970. So it is very prevalent, very medically researched, and that's why we have very much confidence in its safety profile as a substance. So that's a key piece of info there, but I'm curious to all of you, as you talk about your work as KAP providers, do you run into any misconceptions? What are those misconceptions, and how do you walk someone through a better, deeper understanding of what you're working on?
I actually love this question. So if I had $100 for every time that I told somebody that I was a KAP provider, and their initial response was, "Oh, isn't ketamine a horse tranquilizer?" I could probably retire. So I think that is something that just requires a lot of education, and so immediately, as in the 60s, was it used as an anesthetic? Yes, but we're not providing and prescribing in the same dosage to our clients in our sessions now. And obviously there's so much more meaning behind it, including the psychotherapy. And so it just, as long as we have more awareness and more education involved, I think that we can really start to clear up some of those misconceptions.
Yeah, I think probably the two I run into the most often, one would be, I think immediately clients are kind of almost surprised that ketamine is an option on the table and that it could be helpful. So I think what I do is a lot of psychoeducation around the history of ketamine, what it's been used to treat, the research. I usually put it into a broader context of the relationship of psychedelics to just psychopharmaceuticals in general, like SSRIs being related to LSD and early research studies. So I think I just try to normalize and really kind of give context that, this is not just a new thing, this has been here. It's just, we're kind of in a now of resurgence of it at this point in history. So I think that's one thing. I think the other thing that clients typically would be I don't know if I would say it's a misconception, but it's a common fear that I think clients are really worried about, like losing control, potentially having some kind of psychotic episode if they engage in any kind of psychedelic work. So I think doing a good thorough case history, trying to track any potential, family history of psychosis or any other like kind of schizophrenic spectrum disorders is helpful. But I think just really kind of talking to clients about the importance of that fear being almost in a way like this is kind of part of what the experience is all about. So I think for me, there's a lot of relational work that has to happen. Of just people receiving information from a person that they feel is safe and trustworthy, and that they know they can trust you, that if they were to, I don't know, let's say kind of need to fall apart in the experience, that you are going to hold the container for them. And so I think a lot of it is about the relational experience of safety and trust. And so I think the more you're kind of focusing on that, the more it helps people tolerate the fears, which are going to be there no matter what.
Yeah, kind of on your note, yes, I hear that a lot. Horse tranquilizer. A lot of research studies have shown that when it's used in this way and also used in combination with KAP, there's virtually no side effects, no risk for addiction. And even long term, there's some research studies out there that some clients have been on KAP, ketamine for KAP, for 5 years, and no memory issues, no bladder side effects, which you can usually hear about in the recreational population, and like no organ failure or anything like that. Virtually very safe with our protocol.
Thank you for sharing. On the horse tranquilizer piece, something that's interesting that I heard from Lauren Taus. She's one of our clinical advisors. She's based out in LA. Great follow on Instagram if you want more education, psychoeducation, Lauren Taus. She explains, that it's used as a horse tranquilizer because the horse is a very sensitive animal. You think of it as large, and so we're like, oh, it must be so strong, but actually they're very, very sensitive beings. And so using ketamine is actually what's appropriate because of that reason with horses. So I thought that was interesting. Yeah, so I know we're kind of digging into some of these nitty-gritty questions here, so I wanted to turn it over to the audience if people have their wheels turning and maybe they have their own question or concern. Illy, you're raising your hand.
I have a big question.
What's your big question?
How do therapists remain in their scope of practice while doing this?
That's a great question,
Right?
Illy.
I mean,
Awesome. Does anyone want to talk about that? I can also share.
I'll go for it.
yeah, go for it.
I think this is a really important question. I think doing any kind of KAP work, I think being an extremely strong ethical practitioner is paramount. I don't know how many people have been following the FDA rejection of MDMA for PTSD, but I mean, there are a lot of concerns about, and a lot of really terrible, traumatizing experiences of people working with practitioners who get outside of their scope of practice very quick, or unethical things happen. I think for me, having a practice that is really built around a strong ethical foundation, especially in private practice, as a clinical supervisor, it's like, I am the one who is guarding what I'm doing. I have to be able to trust myself. And I think the specific modalities I practice, like somatic experiencing, IFS, coherence therapy, it's also really making sure that I'm extremely well trained in those modalities. So I am very clear of what is within the bounds of that modality. So for example, with somatic experiencing, it is an option that I can engage in very, very, kind of limited forms of therapeutic touch, which can be incredibly powerful for a client. But being able to make sure that I'm navigating consent and how to navigate that through a KAP experience is really just of absolute primary importance. So for me, I think just being really well trained, just really being on your ethics game, I think that can really go a long way. And also knowing when to trust your gut and like knowing your own kind of wisdom as a therapist, and also like having experiences yourself when you can, I think also helps you know the territory, which can be really helpful.
As far as remaining within our scope of practice, I think something that gives me a great sense of relief is knowing that we can trust our prescribers, and so I always defer to them in any way. And so I think that when clients do start to express any uncertainty or fear about what may come up, it's my job to really create that container of space and safety for them and comfort. And so that is usually what I try to set the scene as. And yeah, I think you nailed it. As long as we are remaining ethical, as long as we are staying up to date and well informed, I feel confident and I feel safe and comfortable continuing to offer it.
Yeah, and I'll just touch base on the medical safety around KAP, right? So where the medical team is prescribing ketamine, but like how are the therapists staying in their scope of practice when the patient is taking the ketamine in your office? And so with the blood pressure parameters, of course we ensure safety, so we do have the client check their own blood pressure so that you're not stepping out of your scope of practice by doing medical things like checking the client's blood pressure. Also the client is responsible for their own ketamine, so you're not holding it, therapists aren't holding it, therapists aren't dispensing it. That's all on the patient as well. So it really does help the psychotherapist just focus on what you guys do best, which is the therapy and healing the client with your great modalities. And we take the full medical liability on the medical side.
That was a very important question. Thank you for that.
You're welcome.
Do we have any other questions? You can kind of speak up. Go ahead.
What does it feel like?
Great question. If anyone didn't hear, what does it feel like was the question. Do any of you care to respond, share?
I can share what I usually. Yeah, because usually when clients are visiting me, they're doing their first intake and they haven't had ketamine yet, so I usually try not to over-explain it because I want them to come in with no expectations of what they should have, because everyone's different. We all have our own subconscious minds and our own inner healing intelligence that's going to reveal to us whatever it is that we need to heal. But in a nutshell, my spiel is, ketamine is an anesthetic, so naturally when you feel it in your system, you're going to be nice and relaxed, just as if you were going into surgery. You may feel kind of lightheaded when it starts to kick in. Things may start to look a little wavy. But when it starts to peak and you're putting on your eye mask and you're laying down, it's almost like you're entering a dreamlike state. And in fact, a lot of people describe the experience as a vivid dream. And just like dreams, sometimes we have really crazy wild dreams that we're just like, what the heck was that? Sometimes we have very realistic dreams. Sometimes we have dreams of things in the past. Sometimes they're very short, sometimes you don't remember them at all. And that's literally, the KAP experience can be like that too, very dreamlike, vivid. So yeah, you may feel a little woozy after. And then again, some people don't experience KAP that way right away. Sometimes it's mild, sometimes it's a somatic experience. Maybe they don't go too far, in outer space, but they feel a lot in their body. Their body is calling them in, so they feel energy somewhere moving, they feel something in their chest, something in their heart space. Or their session could be very emotional. Maybe they've been suppressing emotions for all these years, and their experience, maybe they don't go too far out, but they're releasing a bunch of anger, a bunch of sadness, or even a bunch of laughter. I've seen clients release energy with laughter. I've had a client before that rapped throughout their KAP experience, and that's how he was expressing his childhood trauma, and he was just getting out there, and I was like, yeah. So, yeah.
That's really, really cool to hear. Thank you for sharing. Any questions? Go ahead.
How long is that window of neuroplasticity?
So I believe it's a window of up to 7 days is what most of the research suggests. Yeah. But it's kind of peaked after the dosing session. So typically the integration session is timed ideally maybe within 24 hours, but it can be up to 72 hours is what we recommend to make use of that window. Which actually leads me back to something you were mentioning, Brittany. We talked about how ketamine isn't a silver bullet, and we also talked about how different clients can experience it differently than one another, but even from dosing session to dosing session, those sessions can be very different. You also mentioned that sometimes the experience is deep and profound and vivid, and sometimes it's a little bit more gentle, or even, not as strong and maybe quite what the client had expected. And I know that as therapists, you do a lot of work around people's expectations. Have you ever dealt with a client who had a more gentle experience than they perhaps anticipated, and how did you support them in working through that and still getting a therapeutic benefit out of it? It's a curveball question. They weren't prepared for.
So I think it maybe was the first CAP session I provided with Journey. There was a really profound moment for the client when they wanted to go deeper, but it was about maybe 45 minutes in. And I think there was a really incredible moment where they found themselves wanting to go deeper and wanting to, in a way, like, be less in reality. They almost wanted to be more dissociative. And then, in that moment, I just kind of encouraged them to inquire within about where is this desire to be less in reality coming from. And they went in and it became nonverbal again for quite some time. And when they came out, what we then focused on for the last hour of just sitting and doing kind of more traditional therapy was that ketamine in that moment for them was taken out of their experience. And then I think it was really difficult for them to have to kind of work through that there was this desire to not be in their body, not be present at all, and then that became the integration work, was to really understand where is that coming from, and how in a way like this craving intense experience was actually part of a trauma response. And so I think the more we could identify that, it then opened up a way to do integration where we could understand how much like this seeking after intense experiences or a silver bullet can actually be part of the trauma. And that can be a really tricky thing to catch.
I would also agree that my first CAP session was a client who felt that it was very subtle. And I really emphasize that just because it feels subtle or not as intense as the client was hoping for, that doesn't mean it's ineffective. And so in that time, we still really stressed, this is the window of neuroplasticity, and still, strike while the iron is hot. Do something that you didn't typically, in the past, you may not have been as apt to, have interest in. And so I just really honed in on still the neuroplasticity window.
Yes, definitely. So I like to pull in parts work when that happens too, and that is usually super helpful. But even without the IFS language too, a lot of times we have inner subconscious blockages or barriers keeping us from getting deep. Sometimes it's a protective mechanism, like the trauma, we really don't want to go there. And so I kind of reroute the client to think about that. Like, do you have maybe a deep subconscious belief that maybe you're not worthy of healing, or there's a trauma you don't want to face? And it gets their ears like moving. They're like, maybe. And then they go back to you guys and then they work through that. But like Susan said, it works, ketamine kind of works in two ways. So chemically it does cause that change in the brain with the glutamate to increase the neuroplasticity. During the experience, they can have this transcendence type of experience too. So even if they don't have that deep experience, they're still getting the chemical effect in their brain, so they're still getting the neuroplasticity. So I try to remind clients that, like you said, it's not a wasted session. But also there is something called psycholytic dosing sessions, where we purposely dose the client at much lower ketamine doses so that they can have talk therapy with just a little bit of ketamine on board to break through those barriers, to break through those protective parts, maybe talk about things that normally are very difficult to talk about. And so that's always an opportunity to take advantage of maybe a lighter ketamine session and turn that into more like a psycholytic experience.
Thanks for sharing about that. Psycholytic is one of the many modalities we support. So there's in-person and actually remote CAP sessions where the client is in comfort of their own home. There's different dosing quantities such as psycholytic or your standard dosing protocol, or even for acute cases, our medical team will work on that as well and be able to prescribe for that client based on their unique needs. There's also a lot of therapists in our network who do couples CAP, or group CAP, or retreats. So sometimes a group CAP session can also make it a bit more accessible for clients because you're using your therapist's time across multiple patients patients or participants in the group. We always maintain a ratio of 4 clients for every one therapist. So a lot of our therapists get together and they collaborate and they may co-host a retreat or co-host a group experience. And that can be really powerful to have the experience in a group setting. And a lot of our therapists, of course, are using their experience to be able to do that group work together and guide them through that. So just thought I'd mention those options as well. Any other questions?
Just speak a little bit more about the group setting. Will that be like a processing group? I mean, I am planning to host a processing group with so will that be applicable? Most of my clients are doing family origin work.
Yeah.
So it's kind of a focus work. So I'm really curious. I never heard of it.
Yeah, we can definitely share more. I know that Brittany supports our therapists with the prescribing for things like groups or retreats as well.
Can you repeat the question?
Yeah, I was about to repeat the question. Good call. So the question is about group KAP, and so just asking to dive a little bit deeper into group KAP. Liliana was mentioning that that she's doing some group processing work in her therapy practice.
Oh,
So
just to
go ahead.
I'm not doing that. I'm saying, well, I am planning to host a process group
Yes, you're planning to host a process group.
for family of origin issues, not CAP.
Yes, yeah,
Oh,
not
oh.
KAP, but for KAP, we'll talk about
Oh, okay.
what that
Gotcha.
looks like. So the therapists can do this a number of different ways. So part of our model is that you're in your private practice, so you can do it a number of ways. I've seen and heard about groups done a number of different ways. So sometimes the group is together for preparation, dosing, and integration. So they're doing that group processing work throughout and really establishing that group dynamic, and then they're also doing that dosing session together. So that's timed together. So there's like mats set up, maybe in a circle, and the clients all do the dosing protocol synchronously with one another. And so they're diving in there. And that's where our medical team comes in, because when it comes to a group experience, if you have one client who's their first ever KAP session and they're on a lower dose and another client is on a much higher dose, that can create differences in the group dynamic. So we want to be very thoughtful about the prescribing end of a group as well. So that's a consideration for sure. A lot of these groups have themes. They'll have different themes, which really allows the group to go in a lot deeper and support one another. But sometimes the group KAP session is, a 3-hour or maybe a little bit longer if it is a group because of that time to connect. But it can be just a group dosing session together. It can be a day-long retreat. I see a lot of therapists doing that type of thing. It can be a multi-day retreat, even multi-session. So again, our medical team is going to be able to assess what the case is there, and if appropriate, to have multiple dosing sessions in the retreat scenario, that is possible. So there's a lot of flexibility with it. And that kind of leads me to that, this is a new territory for a lot of therapists. You're kind of trying to figure out how KAP fits in with whatever you're doing in your practice and having success with. And the best way to learn and feel supported with that is having a community. So having other therapists who have had experience. We opened in Texas 2 years ago, so we have some therapists who've been here for quite a while and have some experience under their belt. And we were open in New York and California even before that. So our network is all connected. We have an online forum where they're constantly asking questions and commenting and getting together. We have over 50 peer consultation groups. Therapists love education and they love strengthening their experience as therapists through connecting with other therapists and learning. They're constant learners is what I've found. And so there's a lot of opportunities there, and those therapists who do have more experience will then offer trainings for the newer therapists. So we have trainings in EMDR and KAP and IFS and KAP and somatic work and KAP. And pretty much, growing every intersection under the sun possible with KAP. And what's exciting too is we're still on this early part of this movement where you actually have an opportunity as a therapist to start, getting your KAP training and getting experience with that, and then you're combining it with your own specialty as a provider, and you're actually able to kind of become the expert on whatever that intersection is. I know that you've shared a little bit about that. If you have anything else to share about your kind of area or your niche that you're leaning into, I'd welcome you to do so.
Yeah, I would just say, kind of like I was mentioning, I mean, my kind of passion and expertise is in specifically experiential therapies. And you know, before I got into being a therapist, I was going to be a philosophy PhD. So I think the intersection of like psychedelic work, therapy, these kinds of experiential therapies, and things like, you know, existential experience. How do people confront things like death, choice, anxiety? Is there meaning in the universe? I mean, I think the thing I love the most, that I just love to nerd out with clients about, is how I think KAP work in particular, I think really just helps highlight these kinds of experiences in such a just incredibly powerful way. And I think those things end up being what can be most transformative in a lot of my clients' lives, is how they relate to these kinds of bigger existential questions. So yeah, I'm leaning into that, and just using the therapy modalities as a way to kind of explore that experience.
Can you repeat the question, Amy?
Yeah, just your specialties.
Oh, right, okay, okay. So the majority of my clients, and my specialty and niche has always been working with clients with pretty significant trauma history. And so when I started offering KAP to my clients, I assumed that it would appeal mostly to my current clientele, and that would be demographics of ages 20s to 30s. And I was really surprised that actually what I have found is the majority of my clients who are coming in for any KAP are actually clients in their 50s and 60s. And it's a lot of clients who, you know, they are just desperate for something to stick. They have taken every medication under the sun. They've done EMDR, you name it, you know, and they are just at their wit's end and just desperate for any relief. And so, yeah, I was really surprised by seeing the clients that I'm working with most, and it's been great.
Yeah, I would just like to add, I've even seen on our forum teachings on hypnosis and ketamine, which I think is really, really cool. But also to add to, our member therapists, it's their own practices, so Journey Clinical does not, tell them what modalities to use. Like, if you don't want to do virtual, you're not comfortable with virtual, you don't have to do virtual or remote. If you want to just do in person, etc. I just wanted to add that in.
One more question, Jordan.
Yeah, I actually think I'll start with one. Who is a no-go with doing this? Like, are there any clients that it's like, this is not a good fit for? Other than, I know you mentioned psychosis or people who are from KAP, any other ones?
I'll have Brittany talk about some contraindications, and that's all on our medical team to do that assessment, so that can help. Our therapists actually can meet with our medical team to talk about their caseload and assess which clients might be eligible up front. But then once you have that conversation with your client, you can always, and you're maybe a little iffy, but the client would be interested in KAP, it's really handy to have a medical team where you can say, here, have your medical appointment and assess your eligibility. And if they're not eligible, they're going to get fully refunded for that intake. So that's very important. And we say no to people all the time. I'll have Brittany talk about that and how seriously we take that.
So whenever we're doing our intake, our contraindications would be history of primary psychotic disorder or history of schizophrenia. Those are the clients that are like, I'm super sorry, this could potentially worsen your condition. You won't be a candidate, at least for our protocol. Usually everything else, what you want to think about is stability. So medical conditions, are they stable? Bipolar, are they stable? Substance use disorder, are they stable? Are they able to refrain from their substances at least 2 days before and 2 days after KAP? So that everything else we can pretty much work with their primary care providers to get clearances, start at lower doses. We also offer medication management, so if they need to get on naltrexone to help with their sobriety before they start KAP, we can do that at Journey Clinical as well.
What about eating disorders?
Yeah, eating disorders, it's a great one too. So also stability, how stable are they? A lot of times with eating disorders, what we worry about on the medical side is their electrolytes. Sometimes their electrolytes are out of balance, which can cause cause heart arrhythmia, so abnormal heart rhythms and other imbalances that could put them in danger. If anyone doesn't know, ketamine can increase their heart rate and their blood pressure during the session, so that is something that we assess for. But again, if they can go to their PCPs, get stabilized, and send us their most recent normal labs, then we'll keep a close eye on them and go ahead and clear them. Yeah. And we do that often. We collaborate with primary care providers all the time. We get medical clearances, we get labs, we can do all of that.
It's actually Eating Disorder Awareness Week, so that's a very relevant question and a very important population that can benefit from KAP. We just actually shared some information, some stories from some of our KAP providers who specialize in working in KAP and eating disorders. You can find it on our Instagram if you want to check that out as well. I know you said you had some more questions. Do you have any?
Yeah, I wanted to ask too, like I've heard about ketamine being helpful for people with pain. Is there, I mean, pain, depression, they kind of go hand in hand. Is that an added benefit for somebody who's maybe seeing it for depression, but maybe also experiences pain? Will that help with any of that?
The question, apologies if I forgot to repeat any of them. The question is about pain, KAP for pain management or for clients experiencing pain.
Yes, we do see that often, and a lot of times mood disorders and depression coexist with chronic pain, autoimmune diseases, fibromyalgia, and so ketamine can help reset the pain receptors. It is not something we primarily focus on. Here at Journey Clinical, we focus on mood disorders, but a lot of my clients that have chronic pain usually see a relief in that. Or also get to reframe their relationship around their chronic pain, especially if it's something that they cannot change. Our wonderful therapists help them with reframing that and building acceptance and self-patience and love and compassion for their condition.
Question for you on the pain relief type thing. Is this a temporary thing? Is this like a steroid injection that's going to last a few months on end? Or is this going to be as temporary as the actual ketamine consulting that you do with them?
Yes. So the question was, how permanent could the pain relief be with the ketamine?
Not permanent, right? But how long will it last if they're coming in for pain relief? Because ketamine was introduced as a pain relief substance back in '62 when it got addressed in the '70s to use for anesthesiologists.
Yeah.
Is it temporary? Is it something where you prescribe them to a dosage on a daily basis, or how does that work?
Yeah, so when you're actually thinking about a facility that specializes in using ketamine with chronic pain, usually it's repeated maintenance sessions. Again, that's not something Journey Clinical specifically focuses on. Our clients get maintenance ketamine anyways. They usually do 6 to 8 sessions and then maybe continue monthly, every 3 months or so from there. But yeah, it's usually something you have to get maintenance on. And also the length of the experience can determine how long they get relief. So you'll see a lot of pains clinics do ketamine for IV ketamine like 5 hours long. Because those clinics are specializing in chronic pain, and that's what their protocols are.
But you're on a drip the whole time.
You're on a drip the whole time, yeah. And usually, they're not preparing the client like the way we are for a psychedelic experience. So unfortunately, like those clients are very sedated. They're usually given like benzos at the same time, or even propofol. And unfortunately, with benzodiazepines and propofol, they fight with the antidepressant effect of ketamine. So it's solely just the chronic pain in that kind of setting.
Yeah, but it's still an introduction. It's still an introduction for the patient to realize that pain can be completely correlated to psychosis and everything else that's going on within the body. So it's an introduction to realize that you can separate the two if you just put yourself in the right state of mind. Which is okay. All right, cool. Curious.
Wonderful. Well, thank you for all the amazing questions. I know that we have plenty more drinks. I think the last call is at past. So definitely I'm gonna release you in a moment, and you'll be able to get another drink and help yourself to some more food. I do have a couple final pieces to share. First things first, I want to give a huge round of applause to our panelists. learned a lot. I always learn something new when I'm hearing from you, and it's so inspiring to hear about the work you're doing. So thank you for sharing. Thank you for being here. Thank you everyone for being here. A couple kind of calls to action. If you're a Journey Clinical member, make sure you're checking in with me and Illy. We want to get you involved. We are able to sponsor events that you have to help kind of you build your own community around KAP, and much, much more. Many ways to get involved. Peer consultation groups, as we mentioned, lots there. If you are a local therapist and tonight has inspired you and you're curious about adding KAP to your practice, again, please come find me and Illy. We'll also follow up over email, so you'll be in touch. I know that when we had you register, we actually gave you the option to share your info with the group. So we'll be sending out a follow-up email where you can see those contacts. So we really encourage you to stay connected with one another. That's why we're here. We're here to plant the seeds of community. This is like the beginning or the early